Welcome back everybody to a brand new video on the Dentist Saad channel. My name is Future Dentist Saad and today I'm officially a 4th year dental student. 4 out of 6 is still a bit long, but this means that I've finished my 3rd year, meaning I'm a half dentist Saad from now on. Seriously, I am half a dentist by now, so I just wanted to share my experience of what 3rd year of dentistry has been like so far. So we'll go through all of the subjects that we've had exams for, and I'll talk about them in a little bit more detail. So the subjects that we're going to be talking about are listed right here. I'll have timestamps down below if you want to jump around the video to the different subjects, but I do recommend you stay and just watch the entire video because it will be interesting. So go no cause carry the bag.
It's 5 in the morning and I didn't opt for this.
And today I'm here with he's helping me because I'm traveling back to Bulgaria, got some stuff to do, and guess what, I have officially finished my 3rd year of dentistry. Hey, half dentist out here. Yeah. What can I say, big like that? Anyways, so I thought as we go along I'd show you what it's like flying in during the quarantine, and we could discuss the subjects, the exams that we've been through this semester.
If you're wondering why I look like this, it's because it's 5 in the morning.
He's like, I just need to get to bed. The first subject, pathophysiology. Pathoanatomy. So the first two subjects, pathophysiology and pathoanatomy. These two subjects, I've mentioned them together because they go hand in hand. Pathophysiology connects to pathoanatomy and pathoanatomy connects to pathophysiology. Last year in physiology, actually, we learnt about how the different systems in the body work in order to keep your normal body function going. Now with pathophysiology, the word patho means that in this subject we talked about everything that could go wrong with the normal functions of the body. But the specific thing about this is it's the processes and the steps that the body goes through rather than what you can observe physically. For example, what we learned is that pollen in patients that have asthma could cause histamines to be released by the cells in the bronchioles, which causes contraction of the bronchioles and constriction of the airflow to the lungs, which is why people with asthma, especially when they get an asthmatic attack, they just can't breathe. And yes, if you're wondering, this is a medical subject, so it is based on the entire body, not just the mouth, because everything in the body is related. Something that happens in the mouth could affect the lungs, could affect the heart, could affect anything. For example, infective endocarditis, which occurs if a tooth extraction has not been done properly and the sterilization process hasn't been done properly, bacteria can enter into the bloodstream and can travel to the heart, which can lead to the infection of the cardiac muscle. The next subject, pathoanatomy. Now, why did I say these two are related? Remember how we said in pathophysiology we learned about the systems, right? In pathoanatomy, what we learn is what you would observe in these diseases. For example, we have the microscopic slides and the macroscopic pictures that we needed to learn about. The microscopic slides, we learn all about the histology of diseases and how it affects the body on little cellular levels, which obviously we would look through a microscope and observe the different structures that would form. And then the macroscopic is what you would see on a large scale. Like if a patient walked into your clinic, you would see blisters on their hands, or you would see something, or you would see some pigmentation, or you would see some raised elevation on the body, and you'd be like, yep, that could be that disease. That is what we learn in pathoanatomy. Now, I know when I talked about my last semester when we started pathoanatomy, I thought it was going to be one of the worst subjects, but it is actually kind of interesting once we proper got into it and started learning about it, because everything does apply, I guess, and all the systems in the body do relate. And it is just interesting to be like, I see a blister right there, that must be that disease. It's just kind of interesting. Conservative dentistry. Now, conservative dentistry obviously was one of the most interesting subjects that we have had so far. It was so interesting, in fact, that I've done an entire video just dedicated to conservative dentistry. Click over there if you want to check that. I'll leave it in the description as well, so you can keep watching this and just watch that at the end of this video. But to summarize, we started off by learning how to remove caries. We practiced this on plastic teeth and then on real teeth. The next thing we did is we learned how to actually fill that empty space that we had created within the tooth. This is also known as obturation. We learned how to actually fill the tooth cavity that we had created with both composite, which looks like a natural tooth, and amalgam, which is this shiny metal, which is also quite common, but more common in the past than the present. And finally, in second semester of our conservative dentistry of this year, we got to start working on how to do a root canal. We only got as far as creating the initial entrance into the pulp cavity, so we didn't do a lot in the actual practical lessons, but we have done all the theory for it, and I do feel pretty prepared and ready to come back in September and hopefully start working on our root canals. We did get these endodontic files, so I'm excited to use them. Let me just show you guys. Okay, so these are the files that we use for endodontic treatment. So these are used to shape and clean your root canal. So there you go. We learned the theory about them, and then seeing them in person, I'm like, oh, okay, I actually recognize that. Pretty interesting. I'm actually so excited for root canals that I did a whole video judging KSI's root canal. So if you haven't seen that video, I'll put it at the end of this video. Give it a click, give it a watch. I'm sure you'll enjoy it and you'll learn something new. Prophylactic dentistry. Prophylactic dentistry, as its name suggests, these are the prophylactic measures or the preventative measures that we can take to prevent a caries or a disease from ever occurring and to keep our teeth top notch. Here we learned about the progression of caries and how to stop a caries developing further at different stages of its development. We also learned about the chemical and the physical methods that are used in everyday dentistry and in everyday life in order to ensure that kids grow up to have healthy and strong teeth which are caries free, and for adults to have more caries resistant and stronger teeth. So this subject was one of those really important subjects that can be applied to everyone's daily life.
Good morning, ladies and gentlemen. You're all very welcome on board your Ryanair flight to Sofia.
So we've landed in Sofia airport, and the next subject is oral surgery, or in Bulgarian, oralna chirurgia. The next subject for today is oral surgery. Now, oral surgery was another one of my favorite subjects just because of how interesting the subject was and how amazing the teachers were. So I just want to say thank you to all of my teachers out there for this subject, because literally you made me fall in love with it. Thank you. So in this subject we learned some of the other basic skills that we need as a dentist if we're going to deal with patients. The first thing that we learned is how to do a proper intra and extra oral examination, just to see what the situation of the oral region is like. Another really interesting thing which we finally learned is how to apply anesthesia. Now there's many different types of anesthesias, but the most common types of anesthesias that we know about are terminal infiltration and nerve block anesthesia. So these are the two main types that we're going to be using. So obviously we had to learn a lot more detail about them. We also learned how to properly do a tooth extraction and the tools that you're supposed to be using. The tool that we use for tooth extraction is called a forceps, and it looks like this. And get this, your dentist actually doesn't yank your tooth out like they always do in the cartoons. Here's what we actually do. The dentist has to use strong force in a controlled manner That's what our teacher said at least. So we hold on to the tooth and we move it sideways to sideways. And what that does is it actually causes the bone around the tooth to expand. That bone is able to expand. It's perfectly normal. Once the bone has expanded, the tooth pretty much just comes out. So you just pull it out slowly and it should be out. This is how a normal tooth extraction is supposed to be done. Not like the cartoons. No one's gonna be yanking you. No one's gonna be knocking you out. So do not be afraid of going to your dentist. So if that worked, the final subject is oral pathology. I am currently back in Bulgaria in my apartment and it's literally scorching hot. Like it is a whole new level here compared to what the UK was. But I'm loving it. I think warm weather is more of my taste, so I'm enjoying the heat. Let's go. So oral pathology was a short but sweet and interesting subject. It was one of those where I actually enjoyed the lectures and I sit there like, wow, that is mad. So we learned about the different diseases that can occur in the oral cavity. The two main ones being lichen planus, which looks like this, and leukoplakia. We also learned about the different cancers that can occur in the mouth and the different sorts of elevations you can have, and all these sorts of diseases and just abnormalities which you wouldn't see in a healthy or a normal person's mouth. Some other subjects that are worth mentioning but we haven't had exams on yet, which is why I'm not going to go into detail in them, are orthodontics, where we are going to learn how to make braces. So be on the lookout for that video because it is gonna come. Hit that subscribe button, you already know. Another subject is internal diseases, which basically combines physiology, pathophysiology, pathoanatomy, and all of that in a clinical setting where we would have to deal with an actual patient and how we would go about that. Radiology, which is all about the different types of x-rays that we can get. For example, a panoramic x-ray. You might have seen this before, it might look familiar if you've ever been to a dentist. Yes, that is called a panoramic x-ray, which is basically all of your jaw showing all of your teeth, and that's the most common sort of x-ray that a dentist would take. Another worthwhile subject is prosthetics. In prosthetics we learned how to make tooth preparations. I don't think we have an exam on this subject anytime soon, so I'll just show some quick clips of what we did in prosthetic dentistry. So in prosthetic dentistry, we basically learned all the different types of tooth preparations in our practical lessons. So these tooth preparations could be used mainly for making bridges or artificial crowns. For example, right here we had made a temporary crown. I know it's pink colored, but obviously in an actual clinical setting we would use white colored acrylic so it wouldn't look like that. This temporary crown would be given to a patient after we've done a tooth prep on them, obviously because their tooth look much narrower, and they would use this until their final actual crown or bridge had arrived. The final crown or bridge obviously would be made of either ceramic, metal, or metal ceramic. Those are the three main types that we learnt about. Now moving on to the mistakes that I made. Oh, I made mistakes. Everyone makes mistakes, guys. The most important thing is to learn from your mistakes and develop and grow further, and I believe that you can do it. Anyways, going on to my mistakes. So the first mistake that I made this year, which I have to apologize for, is judging subjects before I started studying them. For example, pathoanatomy, I thought was going to be a dead subject. Oral pathology, I thought that was a dead subject. And then I started studying them and I'm like, oh, actually interesting. And oral pathology has turned out to be one of my favorite subjects. So it was literally a case of do not judge a book by its cover. So there you go. It can't get more literal to that quote right there. The second mistake that I made is not spending my time at university efficiently. What I mean by that is, between lessons we would sometimes end up with 1 or 2 hour breaks. While we're doing that, I just go home, eat something, maybe just chill in the canteen and pretty much do nothing, like waste my time. That's what I did in the beginning of the first semester at least. But then later on, one of my friends suggested that we should just do a group study session in the library during our breaks instead. And we started doing that, and it helped so much. And I was actually able to learn some stuff, because subjects like microbiology, oh my god, that I don't know how the heck I would have done that if it wasn't for my friends. So thank you guys for helping out. My suggestion for you guys would be study in your free time at university, and then when you go home, you're literally chilling. You're already done. You've done your homework, or you can just do 1 hour when you go home of extra studying, getting ready for your exams, and then you're sorted. There's literally nothing to do. Another mistake that I realized that I did was making my notes on paper. It is so annoying trying to, because what I do, I like to write on A4 sheets of printer paper with no lines or anything. And I think that organizes it a little bit more, because I give it page numbers, I give it titles, dates, well, obviously trying to organize it all. But still, organizing those papers takes so long, and I can't be asked, and I can't really think of a time when I've actually looked back at all of those papers and studied them page by page. It's such a waste. What I realized in second semester is that I make notes way better when I do them on the computer, because I can get resources both from the lecture, from the internet, from my own personal knowledge, from a book, and put it all together to make one perfect set of notes. And guess what? It's all searchable. I don't have to scroll through, I don't have to look at every single page to find what I'm looking for. I can just press Ctrl F and find whatever I need. The things that I learned. I need you guys to grab a paper or a pen if you have something and just write this down, because you need to use it for yourself to test how well you study and how efficient you are. So I'm just going to wait for a few seconds. Go on, grab that paper. I'm waiting. Okay, so you've grabbed the paper. Thank you very much. So let's start with this. The first thing that I learned is to use my time more efficiently. Let me tell you how I did this. I'm not sure if this equation already exists, but I came up with this equation where when you sit at your table, look at the time you started studying. When you're done studying, look at the time when you finished studying. Calculate how long that was. That is the denominator of this equation. The second thing you should have done, start a stopwatch right at the beginning as soon as you start studying. Every time you take a minor break, you have to stop the stopwatch. And then when you start studying again, start the stopwatch again, and keep doing that until you are done studying for the day. Now take the total time on the stopwatch. This is the time that you have actually studied. Then take the time that you got from the clock. This is the time you spent at the table. So the time you studied divided by the time spent at the table multiplied by 100 should give you a good measure of your efficiency and how well you are studying. I used this in the beginning just to see how well I was studying, and obviously as I changed my tactics I saw, oh, it's improving my efficiency, it's decreasing my efficiency, and you could see different things adding or decreasing to your efficiency. And I think it's quite helpful, so definitely recommend try that out. The second thing I learned is how not to be an idiot and lose my things. Because for conservative dentistry, as I've said before, I lost all of my work pretty much a week or so before I had to hand it in for the final marking, and I was just rushing to everyone's lessons trying to get it done, and I got it done eventually, but obviously it wasn't good as the original work which I had actually put effort into. But I bet there's someone out there who found my work, stole it, and right now they're like, my precious, I've got the works. Give me back my work if you stole it. And the next thing that I learned is how to use my own technological resources properly. I've got so many different apps, so many different websites, and so much technologically more advanced when it comes to my studying. I feel like I need to do another app video just for dental students, which I might do in the future, so stay subscribed right down there below. Finally, I would just like to say thank you to all of my teachers who have helped me out through all of this BS. Thank you for being nice and for being good teachers. And I want to say thank you to all of my friends for being there, for supporting me, even though when I was being annoying. Thank you for being there. And yeah, I want to say thank you to you guys for coming with me on this journey through dental school. We got 3 more years to go and 3 more years of excitement before we go into dentistry, and it's even more lit I cannot wait. Anyways, what I'm trying to say is thank you all for watching this video. Thank you for subscribing. Thank you for liking. Thank you for commenting. And thank you for just being here. If you haven't yet subscribed to this channel, be sure to hit that subscribe button right down there below, because we're trying to get to 500 subscribers this year, and I would really appreciate if you could be one of those 500. By the way guys, if you still don't know, almost every video we have a premiere, and it's always so lit. Everyone that comes to the premiere, thank you for coming. And we just have so much fun in the live chat. So when the video's dropping, come to the premiere. If you want to get more notifications or updates, or you want to contact me or anything, I'll put my Instagram in the description right down there below. Follow me, message me, and whenever you need, I'll try to help you out. My name is Future Dentist Saad. Thank you for watching this video, and I'll see you guys in the next video.